Congratulations, you're presumably watching this as you've just had a baby. And you may be surprised to hear that actually you do need to start using some form of contraception from 3 weeks after having babe if you're not breastfeeding. But don't panic, there are lots of things that can be used for contraception. If you're not breastfeeding, your first period will probably be about 6 weeks after you've had baby. But unfortunately, the way the body works is you ovulate, which is producing an egg 2 weeks before this. And so this is why you need to start thinking about contraception from 3 weeks onwards. If you are breastfeeding, this in itself forms a really good form of contraception, and we call this lactational amenorrhea. And as long as you are the baby is under 6 months old, you are fully breastfeeding with no more than 6 to 8 hours between feeds, and you're not having any periods, this in itself will be 98% effective. So 98 out of 100 ladies who are using this for contraception will not get pregnant. If you want to make this super safe, then you could add either the mini pill, the implant, the injection, or a coil to this, and that will increase your contraceptive cover. We do not recommend the combined hormonal methods for contraception for the first 6 months when you're breastfeeding. If you're not breastfeeding, don't worry, all methods of contraception may then be available to you. The combined hormonal contraceptions, be that the pills, the vaginal ring or the patches, we usually recommend to start from 3 weeks after baby's born. The progesterone-only pill or the mini pill can be started at any time, and your doctor or your nurse will advise you when to do this. The implant we normally recommend to be fitted after 3 weeks, and the depot injection, we tend to say to wait for 6 weeks just for the bleeding to have settled, because we do know if we give you the depot injection before then, we tend to give you more irregular bleeding patterns. The coils, whether that be the copper coil or the marina coil, can be fitted from 4 weeks onwards, whether or not you've had a caesarean section. Diaphragms and caps, if you were using these prior to getting pregnant, we recommend that you go back to the contraceptive clinic and have them refitted, because your size may have changed, and we normally don't recommend this to be done until 6 weeks after baby's born. And don't forget, you can use condoms whenever, wherever, at any point, whether you're breastfeeding or not. You may have heard us talk about long-acting reversible forms of contraception. These can be the implant, the injection or coils. And these, as we've already mentioned, can be fitted within 6 weeks of baby being born. The implant will last you 3 years. The coils, the copper coil, can last between 5 and 10 years. And the hormone coil, the IUS, can last for 5 years also. If you're wanting to space your children, it doesn't matter, these can be fitted and then taken out when you want to get pregnant again, but do last for that duration if you want them to stay in for longer. We tend not to recommend the injection if you're wanting to space your children, because it can take up to 12 months for this to come out of your system and your periods to come back to normal. If you're really thinking of something more permanent and you have decided your family is complete, then you can think about the irreversible methods of sterilisation. Female sterilisation has a failure rate of 1 in 200, where the tubes are either blocked, cut or clipped to prevent the egg from coming down the tubes to the womb. Male sterilisation has a failure rate of 1 in 2,000, and is done under local anaesthetic. These are irreversible procedures, and you must make sure that you are happy that your family is complete before these are done. If you do require emergency contraception, there are several different ways that this can be given. We have 2 kinds of hormonal tablets that can be taken, as well as a coil that could be fitted. If you've had unprotected sex and baby is less than 3 weeks old, you don't need to have any emergency contraception. However, after this, then you would need to have some emergency contraception if you are not using anything regularly for contraception. The 2 different types of hormonal contraception we have is Levenel, which needs to be taken within 72 hours of the unprotected sexual intercourse, or we have Ella-1, which can be taken up to 5 days. Levenel is available at pharmacists and on prescription. Ella-1 is only available on prescription. You can also have an emergency coil fitted, and this can be fitted up to 5 days after the unprotected sexual intercourse, or 5 days after when we expected you to ovulate. These would require you to go into your GP or a specialist contraceptive service.